and I was taken to a black pediatrician in Wilmington, and he was so kind and so knowledgeable in everything, and I just aspired to be like him. I'd just say that those who are following me hopefully will pick up the torch and complete the job of trying to establish diversity and equity throughout this country.
Welcome to another episode of Cobb and Company, the podcast of the Montague Cobb Health Institute. I am Dr. Randall Morgan, President and CEO of the Institute and a proud alum of Howard University, where I attended lectures with Dr. Cobb, Professor of Anatomy. Today, it's my great pleasure to welcome Dr. Richard Allen Williams to the podcast. Welcome, Dr. Williams.
Thank you, Dr. Morgan.
Dr. Richard Allen Williams is the founder and president of Minority Health Institute and the founder of the Association of Black Cardiologists. He was the 117th president of the National Medical Association, and from these organizations he received the Scroll of Merit and Distinguished Leadership Award, the highest honor of the National Medical Association. He is a cum laude honors graduate of Harvard University, to which he was admitted at age 16. Dr. Williams is considered an international expert on hypertension, healthcare disparities, dyslipidemia, diabetes, obesity, heart failure, and sudden cardiac death. He is the author of many books, the most recent of which is called Blacks in Medicine. This year in Wilmington, Delaware, where he was born and raised, Mayor Przetsky led a ceremonial street renaming for the creation of Dr. Richard Allen Williams Way. So, Dr. Williams, congratulations on the creation of this Richard Allen Williams Way on East 13th Street, which is adjacent to the Howard High School, which you attended. You received many tributes, including those from President Joe Biden. How did it feel to have your career and your service and accomplishments celebrated in such a way?
It felt like completing a circle. In many ways, I started everything out at Howard High School. My whole career was based on what I accomplished there before I graduated, which incidentally was the year before Brown versus Board of Education came into being, which means that up to the time of my graduation from Howard High School, I attended schools K through 12, which were all black. I never had any classes or whatever with anyone white or any other ethnicity or race up to the time that I attended Harvard University. So things for me really got started at that juncture. And coming back to the street naming was really, in a sense, completing a circle.
Were there any attendees or family of attendees who you went to school with?
Several. I was really impressed with the fact that so many of my classmates, those who survived from 70 years ago or so, were in attendance there and really very honored with the fact that they came, as well as many of my family members from all around the country.
Well, I personally was disappointed that I was unable to attend because I share your experience. I finished high school probably about 7 years after you did in Gary, Indiana. And my high school was Gary Roosevelt High School, which is one of those nationally known high schools, and it happened to be totally African American. Mm-hmm. And I never had a white teacher, or I never had a classmate until I went to college at Grinnell College in Iowa. So we had similar experiences. But the fact that you are so well beloved in Wilmington, as I think I am in Gary, having practiced there as well, it's just a special feeling to be able to complete that circle that you spoke of. You were admitted to Harvard at age 16, and you were the first black full professor at UCLA. You've opened new hospitals and led new institutions. And a career of first What advice would you give to aspiring medical professionals, such as those who join the Cobb Scholars Program and may often find themselves, if not first, perhaps in a very small minority in their classes and chosen fields?
Well, I think God chose me to kind of lead the way and gave me the torch to begin carrying, kind of like what's happening with the Olympics now. So I was the original torchbearer in many respects. And I'd just say that those who are following me hopefully will pick up the torch and complete the job of trying to establish diversity and equity throughout this country.
When did you feel that you had the capabilities to be a torchbearer?
Being a torchbearer wasn't one of my early aspirations. Just trying to stay alive really was, because I can recall that at the age of 4 or 5 years that I came to recognize the importance of medicine in my life as well as others. And that's because of the fact that I was kind of a sickly child, and I was taken to a Black pediatrician in Wilmington, and he was so kind and so knowledgeable in everything, and I just aspired to be like him. That was my earliest aspiration as far as medicine was concerned. I wanted to be a doctor at that early point. Didn't have any idea of what difficulties or obstructions and so forth might lie in my path, but I knew what I wanted to do from an early point. And my parents encouraged me, as well as many of the teachers at my high school, at all of the schools all the way through. And I somehow made it.
Well, I don't think it's a somehow. I think that a lot of things obviously came together. But could you speak to the skills, the confidence, the perspective that you gained going to Howard High School?
Oh my, they were enormous. First of all, Howard High School consisted of all Black teacher staff, and these teachers, as I was to find out, were some of the finest in the country. They simply had not been allowed to teach at white institutions, but they had PhDs and masters and so on and so forth, all the credentials that any Caucasian teacher would have. It's simply that they were limited to teaching at Black institutions. Of course, this was before 1954. And they were dedicated to making sure that their charges got the finest education, despite whatever anybody might think about Black institutions. And so they laid it all out and went all out to make certain that we got the best education that could be provided. And by that, I mean that they really went out. In my case, once I was identified as someone that the Harvard Club wanted to try to get into Harvard, and that was when I was 15, they gave me extra education. I had, and I loved it, going to school on Saturdays and after school late at night, and paid off because I did very well on the college boards at the time. I scored in the 99th percentile, and that was unheard of, especially for anybody Black at that time. And so that was my ticket to Harvard. At the age of 16, I was recruited by the Harvard Club to apply, and fortunately I was able to get in.
Did you have any of your teachers that had been to Ivy League institutions?
None.
I imagine many of them went to historically Black colleges and universities.
Absolutely, they
in the
did.
South.
All I can do is to repeat that they were so fine, so well educated. I mean, I could pick certain ones who gave me particular instructions and so forth, but they were all just so fine and so dedicated. They wanted to make sure that we succeeded, and they knew that they were limited from the standpoint of being able to teach at other places. They put all of their efforts into making certain that these students of theirs at Howard High School did their best. And so I was fortunate to carry the torch at an early point, finished first in my class, and of course got the the full ride scholarship to Harvard.
What did you meet when you went to Harvard?
I
Right.
met both discrimination and encouragement because I was just one of, I think we had 4 or 5 blacks in a student body of about 10,000. And so we were lost, like specks in a sea of whiteness. And it was very difficult, especially for a young kid who had really not been out of the city of Wilmington. And all of a sudden, here I am at this allegedly world's greatest university in a sea of whiteness. And so, on top of that, my roommates, I had 3 roommates, were all Caucasian. And they had never really engaged anyone black before. So we got together at the very beginning and said, we're going to make sure that we work together because we're having a first-time experience for all of us.
Yeah.
And we're going to make this work. And we did.
When did you realize that you would be a physician?
It's a good question. I guess I wasn't sure until the day I graduated from medical school. Literally because of the fact that we were always told, now, you're in medical school, and I was at med school at downstate. You're in medical school, but don't take it as a given that you're going to necessarily graduate. They invoked fear into us, and there were some students who really got very anxious. And I can recall it was one of my classmates who did not complete medical school. He was so fearful. And he was an excellent student. It was just that he didn't have any confidence, and they didn't build confidence at that particular school. Either you did it on your own or you make it. So to answer your question, I wasn't sure until I actually got that degree in my hand. That's the diploma, that I was going to make it through medical school.
And then your choice of specialty, cardiology, how did that come about?
Cardiology was actually my second choice in regards to a medical career. I wanted to be the world's greatest brain surgeon. That was my original intention. And I actually took a surgical internship at UC San Francisco to begin my training. And it turns out that during my internship, I realized that I really didn't like what I was seeing in neurosurgery. It was a very depressing field, very difficult, took a lot longer than most other specialties to complete. And I asked myself the question, am I really fit for this? Is this what I want to do? And the answer came to me in the middle of the night when I was prepping a patient for brain surgery. As you know, you have to shave the head of the patient. That's the intern's job. And you have to use a straight razor to make sure that all the hairs are off. Make a long story short, while I was shaving this patient in the middle of the night, prepping him for surgery, the razor slipped out of my hand and I instinctively grabbed for it and cut my hand open, wide open. I couldn't operate for about 6 weeks. And during that time, I really asked myself a question, do I really want to pursue this? And the answer was no. So I talked to my superiors and they said, well, we understand what you're saying, but you don't want to change horses in midstream and all that. And I decided that I did want to change. The question was what I was going to change to. So my second love was cardiology. And I changed my residency stream from surgery to internal medicine at USC. So I moved to Southern California, started my residency there at the USC Medical Center, and then subsequently went on into cardiology training.
You have had so many experiences in not only being the first, but creating the first. So we could talk for several hours here about all the different organizations, opportunities, collaborations that you've been a part of. And I must say that we so appreciate you being a board member and a mentor to all of us at the Cobb Institute. And I'm sure that our younger board members and our scholars appreciate that, and we need to lift that opportunity up even more. Prior to your coming this morning, we've had other discussions about mentorship and the program that we have this afternoon by the Cobb Institute and the importance of mentorship. And you've been able to be a mentor in so many different ways. Tell me about the reason for the ideas around founding the Association of Black Cardiologists.
Before that, I go into that, I'd like to go back to something that you mentioned early on, and that was the tradition of Dr. W. Montague Cobb.
Oh, please.
I'd like it to be known that I knew Dr. Cobb, and he was my mentor. Even though I finished my medical school career at Downstate, I started it at Howard University. I don't know whether you're aware of that.
No, I wasn't.
Yeah. And that was when I met Dr. Cobb. And he and I had some kind of synergy. I think it was mainly because of the fact that we both were deeply interested in the history of African Americans. He was, of course, the supreme historian. And so I loved so much talking to him, and it was just a thrill to me to have him devote so much of his valuable time steering me and directing me. And I can remember some of the conversations that I had with him, and not only during medical school, but later when I was writing the textbook of Black-related diseases. And he gave me some insightful information, especially on things like separate but equal, and so many things that he had impacted upon over the years. So I appreciated him not only from the medical standpoint, but from the standpoint of all of the other things that he did. And I don't think everybody realizes just how much of a multilateral genius he was. It's just incredible. So I want to make sure to give full respect to the great Dr. W. Montague Cobb.
Well, we appreciate that, and we had this as the last question, but in some of our discussions, we haven't been able to get to that question and to discuss it in the detail that it should.
Okay.
That we should.
Right.
And certainly I share your opinion of the encounters with Dr. Cobb. And I think one of the things that's very interesting about Dr. Cobb is that he was a mentor for a lot of people.
I don't know how he did it.
In so many different ways. And for instance, Gus White, our colleague,
yeah,
and others who didn't go to Howard Medical School.
Mm-hmm.
So in addition to having, I think, 6,000 students that he actually taught through medical school, he probably was a mentor of another 5,000 or 6,000.
Right.
As being a guest professor or at NMA, or I remember having a lecture demonstration with Dr. Cobb in New Orleans at NMA when we were having lunch. It was all about wine and the types of wine and how you determine wine by how it's poured in the glass and the things that you do before you begin to drink the wine.
Okay.
And I mean, it was just an entire treatise on wine.
He was amazing.
And we were just there to have lunch
right.
at this same convention at the National Medical Association.
And also on playing the violin. You know, he was a fantastic violinist. And many people didn't realize that. I remember once during an anatomy class, he brought his violin in and played a little symphony for us.
And again, if you went to Howard, everybody had that same experience.
Yes.
I don't know if he played the same symphony for us that he played for you, but I can assure you many times he he came in the anatomy lab,
Yeah.
usually between 1 a.m. and 2 a.m. With the violin.
Yes,
as you were getting ready
that's
for
right.
the cadaver walk.
Cadaver walk, which I'll never forget.
That's exactly
My
right.
God.
So I think the history is just really important.
Yes.
And it's more important than ever because, as you know, we had a symposium at Howard this past year that I was very proud of.
Yeah, I
The
wasn't
Cobb
able to
Symposium.
attend that.
Right.
That was in January.
Yes, in January.
Right.
And so we spoke to a lot of students, medical students, and asked what they knew about Dr. Cobb. This, of course, is before I gave my talk. It was crickets. And that was really very impactful to me, that we've got to do a better job of keeping the history alive as well, particularly for young professionals, individuals that are in the field of medicine.
I don't think enough history has been written about Dr. Cobb.
No.
And I think those of us who had contact with him need to write that history. So maybe you and I can collaborate on some things there.
Well, I would love to. I've been fascinated not only with Dr. Cobb, but the relationship with many of the faculty members at Howard, and come to understand how important they were in their respective fields.
J.B. Johnson.
Right. Roland Scott, all these individuals that were the first in their specialty fields, and they were faculty members as well at Howard.
And especially LaSalle Lafall.
Yes. Yeah.
Right. I could tell you some things about my relationship with him as well.
Well, I think mentorship and sponsorship and all of these terms we hear over and over again.
Yeah.
But sometimes I think it takes a while before you really understand that you were mentored by somebody.
Right.
I mean, you may have been in their presence and didn't realize that they were a mentor until down the road. But I think I've heard the same comments that you've made about Dr. Cobb from many other colleagues. So he certainly was very consistent.
Very much.
But I think his love, not only love of history, but the presentations that he had in the Journal of the National Medical Association about previous physicians and hospitals and their impact was so significant that it really should be required reading for all of us.
And one of the things that I hope will be stressed in whatever is written was his relationship with, I think it was 7 presidents of the United States when he held the Imhotep conferences at the White House.
Yeah.
Nobody's ever done anything like that, and I doubt if anybody will ever do it again. But that had an impact on on a lot of important legislation, such as the Civil Rights Act and the Voting Rights Act in 1964 and 1965. He was the person that, and Medicare. He was the person that really brought that about and moved the conscience of the presidents to get those bills passed and signed. Fantastic accomplishments, which people need to know about.
So what do you think the role should be of the Cobb Institute in making sure that the legacy of Dr. Cobb is not lost?
Well, I should be asking you that question because you have provided such fantastic leadership with this organization, which is, as we all know, a byproduct, I guess you might say, of the National Medical Association, and has served for 20 years in a fantastic capacity of being the educational and scientific arm of the NMA. I just first want to congratulate you on the role that you've played. As you know, I'm one of your biggest fans, and I think that's all very well deserved. So if I were to answer the question about what we need to do in the future, I think it needs to, I would answer it by saying we need to go back. It's almost like going back to the future. Go back and recapitulate all of the things that you have done and have led, and make sure that we put the resources together to carry on your legacy with the Cobb and get the job done that we have promised to do.
Well, I appreciate that. That is not really kind of what I had thought about, but I do think, going back to the discussions that I've had with medical students, and particularly Howard medical students, that the same can be said for members of the National Medical Association, that so many do not know the history
Correct.
of the association and of its leaders and of those who served as president. John Kinney Jr., so many different individuals that I think is really important for students or members even to have that master course, and maybe taking advantage of the work that you've done and the late Michael Bird and others in putting this history together. I think particularly during this time when people are overtly trying to erase our history.
Correct.
That this is a part of our history, and it's our responsibility to make sure not only will we preserve it, but that everybody knows for generations the contributions that were made.
You mentioned Mike Bird, and I certainly think that everybody ought to know about him and his contributions to Black medical history, and both in the writing and the doing things that he accomplished. The late Michael Bird, great Michael Bird. Remember that his wife Linda is still with us.
Yes.
And I think that she could contribute mightily to what you just mentioned.
Yes. And in fact, Michael Bird, if I'm not mistaken, was the first W. Montague Cobb Distinguished Service Award.
Okay, I'm not sure.
It was one. Well, in our program book, as our staff knows, we have the list of every honoree, both the Cobb Distinguished Service as well as the Lorenzen Award and the lecture. So all three awards, and it's really a who's who. And I do believe that Michael Bird was the first or the second of the awardees that we had back in 2005, 2006. So we will take your advice on that and make sure that we lift our history, both of the Cobb Institute, and we actually are working on that now to try to categorize what we have done and try to get it some sense of organization, because obviously we're looking at transitions, succession planning, all those things, and it's important to have that information, and for our board even to have that information. So that's one of our goals this year, is to try to go back over the 20 years and make sure we have all the important documentation.
Good.
As you know, the NMA is moving to a different location in Silver Spring, about a block or two away from where it presently resides.
I didn't know that.
But in the process, this past month, they were going through all of the archives and folders and those kinds of things. And I think they identified a lot of unbelievable documents. And the question is, what do you do with them and where they should go? How do you protect them? Like the second or third journal of the National Medical Association. But that's not really the time to do that kind of planning of your archives when you're under pressure and you got to move from one place to the other. I mean, we need to have a more systematic way of doing that. And one of the regrets that I have is that in 1995, when I was elected president-elect of NMA, we met in Atlanta for the 100th anniversary. And prior to that, we had several things happen, including Dr. Cobb's death in 1990. because he had the entire repository of the National Medical Association in the basement at 1012 10th Street, plus what he had at home, plus a few things that were at Howard. And we still have not really been able to recover all of that information. And I literally know that's the case because I was an officer of NMA coming up during that time. So it greatly diminished what we had at the Centennial to share from a historical point of view. And so as an organization, this is the National Medical Association. I'm not talking about the Cobb Institute.
Right. I understand.
That there's a lot of work that needs to be done on archiving. And to your point, Michael Bird and Linda Clayton, I distinctly remember their place of residence in Boston,
right,
where they had an apartment
with all that
was a library.
That library.
They lived in one apartment, rented another apartment where they had their entire library.
Whatever happened to that library? Because I remember talking to Mike about.
I'm not sure.
Efforts.
I think it's in Nashville. I'm not sure, but I need to find out from Dr. Clayton.
They were always trying to find a repository for all of their books. And I mean, they had a literal library. I visited their residence in Boston. And
I mean, that's like amazing.
Yes, absolutely amazing.
I mean, serious, important books.
Yes.
Not Marvel comics.
Right.
And that kind of thing, but serious library that totally focused on medicine and Black history.
Right.
So that's something that we need to find out. Unfortunately, Dr. Clayton is still here, but we had actually, Michael Bird and I had spoken too about Cobb Institute being the natural repository for their library.
Yes.
As well. So we've had a lot of recommendations of what Cobb should do, what Cobb could do. And so now we need to have discussions about what Cobb actually can do, given the time and the resources that we have. And no time like the present.
Right. I agree. You asked me a question about the ABC.
I asked you about the ABC.
Would you like to explore that for a moment?
I would very much.
Okay. I'll try to be as brief as possible with the history of that. But this goes back to the time that I was in my cardiology training at Harvard Medical School, and that would have been 1968, which is when I started there. And that was the same year that Reverend Martin Luther King was assassinated. So I was recruited, I think partially because of the fact that so many people had so many misgivings about Dr. King's assassination. They wanted to do something to reach out to the Black community, I guess you might say. And this is a medical outreach, so to speak. So I was recruited to do my fellowship in cardiology at Harvard Med School, partially as a result of the assassination of Dr. King. When I got there, I realized that there was no one else Black around. And as I explored things further, I found out that there had never been any Black medical postgraduate trainees in any of the Harvard hospitals, and subsequently found out that also at Boston University and Tufts University in Boston, there also had not been any Black postgraduate trainees, that is, interns, residents, and fellows, and research assistants, and so forth. I thought that was rather odd, but given the times and history and tradition of medical institutions, I realized that it should not be surprising. So I set about trying to see what I could do to help out, I guess you might say, impact upon or rectify the situation, and talked to a number of people in Boston. It eventually turned out that a lot of folks were interested in that. And we devised a plan to start a recruitment effort. The only thing is that we had no funds and had no mandate from any of the institutions, so we started one on our own, and I called it the Central Recruitment Council of Boston Hospitals. And notably, Dr. Vivian Pinn worked alongside me in putting that all together. So that's also part of our Black medical history. We subsequently were able to convince Harvard Medical School to give us some funds to start a recruitment effort. They said, okay, if you know some Black students who can qualify for the rigors of education in the Harvard system, bring them to us and we'll consider them. So we did that. First, they gave us $50,000 for the recruitment effort, and we went to around the country ourselves to different institutions, starting with Meharry, where we found our first 2 students that were admitted to Harvard postgraduate education. And then we went to Howard and encountered some students there, to the University of Florida, even to the University of Puerto Rico, because we wanted to make sure that we extended our efforts to the Hispanic students. And we were successful. After a year, we had recruited several students to enter into the Harvard system for the first time in history. And that became very significant because today it's wide open. Harvard has a number of Black students that they didn't have before, and Black postgraduate trainees, interns, residents, and so forth. The hospitals are full of them, and they are fully committed now to health equity and diversity. So I think that we got something good started there.
When you began this process, was it across the board for postgraduate training? Or was it orthopedics, cardiology, OB-GYN?
Right, absolutely.
None of them. In 1968, I was a junior at Howard, and, with the whole Martin Luther King assassination and the burning of 14th and U Street and so forth.
Yes, I remember.
So it was a dramatic experience. And so at that time, what you're saying is that there were no postgraduate.
There were none.
Trainees.
Zero. I was the first one in the entire Harvard system and in the entire Boston hospital system, which amazed me. And it wasn't as though they didn't have an opportunity to do it, because there had been several candidates, so to speak, who were excellent students and so forth, who had not gotten the opportunity. And I think it was because of the fact that the systems were not challenged or pushed to do it. Once the federal government mandated that in order to get federal funds, they had to have, some of these institutions had to start bringing in Blacks and other minorities, then they got motivated. The other thing was that around that time, the Black Panthers and the Black Muslims and so forth were very activated, especially in regards to issues like sickle cell anemia. And there were things that were happening, especially in the wake of Dr. King's assassination, that people were on the move and they wanted to get things done. So part of what I was able to do was motivated really by working with the Panthers and with the Muslims in Boston. We put together a meeting with the dean of Harvard Medical School, who came down to Roxbury. Actually, it wasn't that far because Harvard Medical School literally sits in Roxbury anyway, and came to a Muslim mosque and sat down, and he said, I'd like to answer any questions that you have in regards to what we're doing at Harvard and be able to help in any way that we can. And several of the brothers got up and said, well, things have always been discriminatory in Boston, and we only have 8 Black doctors that practice in this city, and none of them were trained at Harvard Medical School, and so on and so forth. And he said, well, at the end of the day, we'll do everything that we possibly can, I promise you. And he did. That's when Vivian and I were called into the conference room at Building A at Harvard Medical School and asked to tell them what we wanted, and we told them we wanted to try to recruit some black students for Harvard Medical School, and they gave us the money to go and do that. So,
and was she representing Tufts as well?
She was really just representing black medicine, I guess you might say, yeah, as Vivian often has done.
Yes.
And there was another young man who was from the Tufts system. But at that time, Vivian was a research trainee at Tufts in renal pathology.
Pathology, yes.
And that's when I first met her. And we worked with several other people like Dr. Alvin Poussant, who was one of the 3 faculty members at Harvard Medical School. They didn't have much faculty there either.
Right.
So it was a discriminatory system. And they didn't really have any plans to do anything beneficial for black medicine or black patients until we came along and kind of shook up things at the risk of losing our my fellowship and our positions, but we were able to prevail.
So then the year of founding for ABC was?
And then the year of founding for ABC was 1974, precisely 50 years ago. And I had finished my fellowship at Harvard Med School in cardiology and was very, very concerned about the lack of a consideration for cardiovascular disease in blacks. The prevailing perception at that time was that black people didn't need any special focus. The very eminent Dr. Paul Dudley White told me directly that he didn't believe that as he put it, the purebred black or Negro actually ever had a heart attack. And I was amazed at that statement. And that's when I decided we needed to get some more information. And I decided to do some research on my own and wound up writing the textbook of Black-related diseases, which was published in 1975. So, but anyway, back to the ABC, out of all of those deliberations came my determination to see what more we could do for cardiovascular disease in blacks to address those issues. And at the meeting of the American Heart Association in Dallas, Texas in 1974, I pulled together all of the black cardiologists that I could, and then we could only identify about 15 in the entire country. But many of them were attending that convention, and I asked them all to come to a dinner meeting that I was arranging in a restaurant in Dallas, and that's when we founded the ABC, the Association of Black Cardiologists, and we went on from there. That was, as I said, 50 years ago.
Well, that has special meaning for me because I started my practice in orthopedics at Northwestern on July 1st of 1974.
Wow.
And so lots of milestones there. And then we, probably 20 years later, formed the Gladden Society in orthopedics. Similarly, pulling together those who were in orthopedics and, having an official organization as well.
Yeah, I think you and Gus White were leading that.
Yeah, I was one of the founders of that organization as well. But I really am. I've always been interested in ABC for a number of reasons, not the least of which is when I was president of NMA. On any given day, the primary questions you get are about heart disease, diabetes, hypertension.
Mm-hmm.
So I had a constant communication between ABC for the entire year I was president, and I was able to get information or I was, and more importantly, able to have surrogates that would speak on behalf of the National Medical Association through me, and ABC was the portal.
Mhm.
And I always felt that that was what should be done at NMA
Right.
anyway.
And
Is
actually,
working through the subspecialties in
Mhm.
real time.
You're exactly right. And actually, some things were done through the NMA vis-a-vis ABC, especially with our relationship with Dr. J.B. Johnson, late Dr. J.B. Johnson at Howard. I can recall that during a convention of the American Heart Association, which was in Anaheim, he came to my house along with several other people that were invited. And this was in the years immediately following the founding of ABC. And he said he wanted to make sure that we received his blessings and the NMA's blessings for organizing this. And it was something that was of great importance and great need. And that was really a big spark for us, a big inspiration to hear that something like that coming from such an iconic person.
Right. And those are the ones that often affect change,
Yes.
because I know for a fact that ABC was not welcomed with open arms by the National Medical Association,
Correct.
nor was the Cobb Institute welcome with open arms,
That's correct.
even though it was established by the National Medical Association.
Right.
And so it gets back again to people not really understanding the depth and breadth of what we're dealing with. Need for subspecialization, need for focus, need for agility, need for more opportunities for more people to be leaders. And so hopefully now we've gotten over that we have the ABC and we have the Gland Society, we have the the nephrologist organizations, we have the urologist organizations that help to keep the association current
Correct.
and focused on what associations should be, and that is supporting members.
Mm-hmm.
But you can't be everything.
That's correct.
You think you can, but you really can't. So I've always viewed the Cobb Institute as being a subspecialty in research, in the broad research.
Yes.
And that would be the major contribution that I would say.
Well, I think it filled a gap.
It could be, yeah.
It definitely has filled a gap that the NMA has had for so long, and it has filled it very well. So I think the Cobb can be proud of that.
Well, any last thoughts? I mean, you and I, of course, could talk forever about all these things. And obviously, we didn't talk about music.
Right.
So I'm sure that historically, you can probably share a treatise or two about what goes on in the brain that makes physicians musicians.
Right.
Going back to Dr. Cobb and others.
Exactly.
But there obviously must be something that there's sort of this shared skill, affinity, interest. I don't know what it is, but I think it's helped both of us to have long lives and
I think so.
And be able to meet a lot of interesting people.
Right. And to stay well. There's actually a great deal of research being done on what I call the synergy between music and medicine. And a lot of that is being done by a gentleman who is a physician and musician himself, Dr. Moshe Lewis of San Francisco, who has an institute now of music and medicine in that city. And in fact, I'm going to be interviewed by him next month in LA. But there is this interest in how music affects the brain and how it interdigitates with medicine and medical ideation. So it's a real thing. And as you know, it's really effective. There's so much that we get out of music and so forth. And I'll come back finally and say that I really enjoyed playing at the legendary Minton's nightclub last night.
Yes.
With this incredible, one of the best young piano players I've ever heard. This guy was like Phineas Newborn Jr. and all of the great piano players that you've heard all rolled into one. I'd never seen anything like that before.
Well, thank you so much for the recommendation. And as we were discussing this, I always come up with ideas, as my team knows. Sometimes they run when I have an idea. But I think we should have a podcast about music and medicine.
I'd love it.
And I'd like to say that our immediate past president, or chairman of the board, Dr. Alvin Crawford, has just written his book and is actually this year the Bone Doctor's Concerto.
There you go.
And so he's now on the circuit promoting his book. But I think having a discussion with Dr. Crawford and you, for starters, with just about music and its effect on the brain, and maybe one of our psychiatry leaders like Dr. Bailey, for instance, as another board chair.
Perfect.
And just kind of talk about that. That would be something that would be so unique. So,
great idea.
So hopefully maybe we can accomplish that.
Yeah.
I know Dr. Crawford would be very happy to participate as you always are. So.
And I would be fascinated to see what you have to say about that too, because you have your expertise in that area that needs to be expressed.
Well, thank you so much for your time. Thank you for being who you are and being such a role model and colleague for all of us. And I'm happy that you have shared your time and intellect with the Cobb Institute and understand the importance of what we're trying to do.
Thank you. Can I make one final statement? I've got this hardware all around my neck, and the reason that I brought this was to use them to instigate discussion and so forth. So one of these medals is one that I received recently. It's the U.S. Presidential Medal for Lifetime Achievement from President Biden. And the reason that I got that was because, in part, of what I've been able to do with organizations like the Cobb Institute in regards to the volunteerism that I've put in to try to move the needle on diversity and health equity. So I'm very proud to be able to share that with folks in regards to what I've done and what needs to be done by those coming along in the future.
Absolutely. It's super impressive. Super impressive. And we have, unfortunately, lost our past board member and leader, Dr. Edith Mitchell, who was a close colleague of yours and very involved with the Biden administration, moonshot.
The moonshot especially.
But we have had, as a Cobb Institute, we received a lot of publicity. We were included in a lot of press releases about the work that we have done with regard to COVID and the vaccination efforts across the country, particularly in the South, with vaccine hesitancy and so forth. So all these things are circular, and I'm sure that the relationships of you and Dr. Mitchell and others have opened up the administration's eyes to what you are involved in, which includes the Cobb Institute. So we thank you for that.
Thank you.